Hello, beautiful mamas. So it is now week 24 of our pregnancy and we got lots to talk about, so let's get right into it. Right now, your baby is over a pound in weight, which is crazy considering the last few weeks. For half your pregnancy, we're talking about ounces. And now your baby is about a pound and a half to a pound and a quarter, or a pound and a quarter to a pound and a half, somewhere around there. Your baby's also about a foot in length and it's about the size of a grapefruit. So he or she is growing leaps and bounds, which means your tummy is growing leaps and bounds as well. So right now, you should have gained about 11 to 18 pounds, depending on your height, weight, various other things. But that's definitely a safe range. Your uterus now reaches well above your belly button. So if you were to palpate and feel, you can kind of feel where it starts to get a little hard, and that is going to be above your belly button at this point in time. In addition to that, it looks like you're kind of smuggling a soccer ball at this point. Your belly's growing, it's maturing, it's doing everything it's supposed to be doing. Between week 24 and 28 of pregnancy is typically when most women have a glucose screening test done. Gestational diabetes is something that only occurs in women that are pregnant due to varying levels going on in their systems. So GD is a condition where you have a lower tolerance for glucose in your body. Now, only 2 to 5% of women actually get gestational diabetes, but it can cause some severe complications during pregnancy, so it's something that you want to test for around this time. So during your glucose screening, if you have a level of 140 milligrams per deciliter, it could mean that you have gestational diabetes. So typically during a glucose screening test, you're going to go to your local hospital or lab, and they're going to give you a bottle of Glucola. Now, Glucola is a sugary, syrupy, kind of thick and nasty tasting drink that you will drink within a short period of time. It contains 50 milligrams of sugar, and an hour after drinking it, they will test your blood sugar levels. If the test is negative, which is under 140 milligrams, then you don't have to do anything else and you pass with flying colors. Now, for some reason, the test comes back close to 140 or above 140, then you'll come back for a 3-hour test, which entails you taking another syrupy drink, but instead they test your blood every hour for 3 hours. Not as much fun. Hopefully you don't have to get to that point. If you have gestational diabetes, it's something that's very easily manageable through proper diet. Talk to your doctor about what kind of foods you should be eating, especially those low in carbohydrates and sugars. And usually with proper nutrition, you'll be fine for the rest of your pregnancy. The great thing about gestational diabetes is that it does subside right after your child is born. So basically, you go from having it to not having it in a very short period of time. So one of the best jobs I have being a birth doula is giving women information so that they have options about how they want to proceed throughout their pregnancy. Now, you might think that this Glucola drink is the only way to have a proper glucose screening. Not true. At my midwifery practice that I go to, my midwives gave me a choice of drinking this, Welch's 100% grape juice. Now, you would think that this wouldn't really do the trick, but it actually does, because if you read on the label, this drink has 46 grams of sugar. If I can there we go. 46 grams of sugar per 10 fluid ounces, which is 1 bottle. Instead of going to the lab or the hospital and drinking a giant bottle of that Glucola, I'll drink this instead, and they'll do the same blood testing. It's not as toxic as the Glucola is, doesn't have as many crazy ingredients in it, and it obviously tastes a lot better. Second alternative to the Glucola drink is a little known fact that eating 60 jelly beans, approximately 60, you can get the same sugar level reading as you would if you drank the Glucola. So if you are someone who is really into not putting tons of processed things into your body, eating organic jelly beans or regular old jelly beans, if that's what you choose to, will do the same trick. And the third option you have is to do a glucose screening prick test. So basically you come in for a week straight and they'll prick your finger and they'll take a reading of your glucose levels, and that will equal the same information that they would gain through the 1 hour glucose test. Voila. So I'm just really happy to know that we have options out there that most women don't even know about. And a conversation went on in one of the mom forums that I'm on Facebook, and people were amazed that this was even an option. So definitely do your research, make sure you get all the information and make the choice that's best for you. And now on to the goods, baby bump time. So this little lady, I love saying little lady. This little lady is growing. She is, oh, let me move back a little bit. Okay, there she is at 24 weeks. Yes, it looks like I'm smuggling some sort of circular ball-like object. But I feel really good. Exercising, dancing, drinking lots of fluids has helped me a lot. And I'm just excited about all the possibilities of having a daughter and having a new baby in this house. So the smell of babies, it's so lovely. Anyways, so that's all I have for you ladies this week. I know it was a lot of information to process, but take it all in, read up on it, Google till your heart's content. You know, I mean, I say be wary of Google, but sometimes Google can be really beneficial. So if you ladies would like to have the birth you desire and deserve, please check out readytopopdance.com, and I'll see you guys next time. Bye!